Good evening, everybody. My name is Krista. I'm here to talk to you a little bit about organ donation. Has anyone here ever heard of organ donation before? Yes. Okay, all right. Imagine spending your life exactly how you planned. Growing up, getting married, having children. Your life would be perfect. For some people, though, they do not get every dream that they have. Even worse, some people give birth to children that may potentially need an organ donation. Rhonda Smith delivered her daughter preterm at a mere 32 weeks, 8 weeks sooner than her approximate due date. Prior to Destiny's delivery, doctors noticed that Destiny had a potential blockage in her small bowel. The blockage was caused from a small bowel that did not fully form during pregnancy. Destiny needed a transplant after delivery and was put on the transplant list. From birth until Destiny was about 3 years old, Rhonda drove Destiny for over 10 surgeries and hospital visits, but she also worried about nutrition and patiently waited for a call that Destiny would get her transplant. When that call finally came, Destiny underwent a 10-hour surgery to get a new small bowel. Destiny Smith is a 3-year-old little girl who was given a second chance at life because of organ donation. Even with hearing Destiny's story, some people may still be against organ donation, or they may just simply be unsure if organ donation is right for them. Although there can be a few negative aspects to organ donation, a person should look beyond the negative to realize how amazing organ donation can be when they understand how it works, what can be done, and the life-saving statistics that prove organ donation is truly worth the decision. Let's take a few minutes to discuss the negative consequences to organ donation. You're aware that some complications could occur, yeah? The first disadvantage is being selected by UNOS, or United Network for Organ Sharing. While UNOS does not mean to be a negative aspect for organ donation, some people can argue that waiting for selection and approval to receive an organ, and a transplant with UNOS can be very difficult. Even more, some people never get off the transplant list with UNOS because there simply is not a match for the organ they are in need of. If you've been selected by UNOS, another negative aspect of organ donation is the possibility of rejection. Every person runs the risk of rejecting the organ that they transplant. But with today's technological advances, rejection is less likely through taking medication to suppress the immune response. As well as rejection complications, some people may also face developing diabetes after a transplant. Doctors are more capable now than ever before to monitor symptoms for developing diabetes. Occasionally, there can be additional complications such as infection, loss of feeling at the surgery site, and if you're a living donor, you may even face death. After surgery, there is always the recovery as well as the cost for surgery. The recipient will need to have a plan in place to pay for the organ, such as medical insurance and having assistance at home to help aid in recovery. Some patients also report psychological and emotional effects after organ transplant. This could be a feeling of guilt if the organ has come from a patient that has passed on, or it could be psychological factors similar to feeling that the organ is not one of your own. It can feel a lack of connection to the organ, and you could just genuinely feel like it doesn't belong in your body. These can be helped with after-surgery counseling sessions or by talking to your doctor. These disadvantages to organ transplant can happen, but they do not compare to the amazing benefits. The first advantage to organ donation, saving lives. If you decide to become an organ donor, you will be giving life to someone who is slowly dying while waiting for an organ, possibly even a child like Destiny. Living donation is where you donate an organ such as a kidney or a partial lung donation. This donation works the same way, except the donor chooses the organ and the recipient. Likely it's a family member that's in need, somebody that you know that needs an organ that you're a match to. Organs may also be donated to medical research, where doctors and students use the organs to perform research in order to save lives in the future. With organ donation, the donor or their family does not pay the cost of the donation and surgery to do so. Another advantage is recipient gratitude. The amount of appreciation the donor will receive for the gift they have given someone else is beyond anything you could imagine. In addition, a part of you will live on. Either way, through living donation or through donation after death, a part of you will live on while helping another person to live a full life with their family. One of the most important factors to take into consideration is the funeral. Organ donation will not be a factor in your funeral choices. You can still have an open casket funeral if you choose to do so after organ donation. Body disfigurement is very unlikely, which still makes the option of open casket available. You may wonder how exactly organ donation works. There is living donation, in which a person is willing to donate either a part of their lung or one of their kidneys to someone in need. Most likely, again, the closest match for someone like that is a family member. In more saddening circumstances, there is organ donation from patients who are considered brain dead or whom have passed on. The patient is declared dead or brain dead by the hospital as well as doctors. The next step is determining the eligibility, whether it's through paperwork consenting to the organ donation or from family members. Next, the organs would be harvested. If you choose to donate all of your organs, the doctors that will be transplanting the organs will come and get the organs, and then they'll be transported to the recipient. Organ donation goes beyond organs. Today you can choose to donate your organs, tissue, or both. Organ donation is specific to the heart, lungs, kidneys, intestines, pancreas, and liver. Tissue donation would allow for donation of bone and bone marrow, corneas, veins, your skin, heart valves, and tendons. Most importantly with organ donation is the amount of people that you can help save. Did you know you could save as many as 8 lives? Approximately 123,000 people in the United States alone are waiting for some type of organ donation. This makes the daily average of 21 people that pass on daily while waiting for a transplant. 21 people every day. For people who are lucky enough to get an organ transplant, the success rate is between 80 and 90% for transplantation. The amount of success could likely be attributed to the immune response suppressing drugs that are given at the time of transplant. Organ donation is quite possibly one of the greatest medical advancements that can be done. Although there are disadvantages to organ and tissue donation, the benefits are much greater. Some people have heard the rumor that if you choose to be an organ donor and display that choice on your identification, that medical professionals would not help to save your life if you were in an accident. This is simply a rumor and not true. Medical professionals do not determine that one life is more important than another life, and they will make every attempt to save your life if you are in need. Medical professionals and doctors take an oath, and failing to save a person based on their organ donation status would be a direct violation of the oath they have taken. Before I conclude, I would like to let everyone know that in the time you've listened to this presentation, one more person has been added to the transplant list. Thank you all for listening, and hopefully this information will help you decide if you want to become an organ donor or not. Does anybody have any questions? Thank you for coming. Have a good night.